My name is Mary Lloyd Ireland. I'm an orthopedic surgeon. I'm a full professor in the Department of Orthopedics and Sports Medicine, and my specialty is sports medicine. So I see patients of all ages, from 8-ish or something like that to 80, maybe 90. They are athletes who are in competitive sports of all types, and I'm seeing more and more active adults who remain active, and that's our goal, to keep them being able to do the things that they enjoy doing, to stay in shape and to feel good about themselves. So I see a variety of age groups, but in sports medicine it's usually shoulders and knees are the joints that we seem to see most often. Sports medicine department has sports medicine fellowship trained primary care physicians and orthopedic surgeons. So we have gone extra miles to do fellowships. Our fellowships have been in different cities, so we feel very capable of taking care of that injured athlete and getting answers quickly. Advanced imaging such as x-rays, MRI scans are immediately available, and we really want the athlete or the active adult to come see us because we can take care of them in a way of maybe surgery, maybe not, work with them to get them back into the game that they most enjoy. So if I see an injured athlete, I really like to communicate with them and their family and their coaches and really tell them what is going to be involved to get them back into the game, whether it's needs surgery or whether it doesn't need surgery, because I think that athlete, that's everything to them. And so if they have a game plan, they can understand it. So the game plan, if say for example they tear their anterior cruciate ligament, which is pretty common in basketball and soccer, particularly in girls, we need to give them what they need to do to get back and kind of have almost a contractual deal of like this is what I'll do, you got to do physical therapy, and so everybody's on board. So I've been at the University of Kentucky for 13 years. Prior to that, for 22 years, I was in private practice, and I had a great opportunity to come to the university to teach the residents. I want to teach the residents how I want to be taken care of, and that involves taking time to get to know the patients, understanding how to examine the patients, because the history and the physical is really so key. We have a lot of imaging, but you can get a lot of the diagnoses, particularly in sports medicine, if you know how to talk to patients and how to examine. The most rewarding part of my job is to see an injured athlete get back on the field, or to see anybody happy with what I've been able to do to maintain or get them back into what allows them to be active physically and also mentally happy, because when you can't move or you're having issues just with physical activity, then that affects a lot of domains, including the mind. So if I can see that athlete running on the football field 6 months, 12 months after his ACL reconstruction, or see an older individual doing overhead activities, whatever they want to do, who's had a rotator cuff repair, that's what really makes me feel like I've made a difference.